It's got a slider device here. If I let go, that's catching on the teeth right here. Okay, there's a little ball in there that's catching on those teeth. So to make it slide easily, you just pull this metal piece and it telescopes up and down easily. Okay. So I got the groin strap, I got the splint itself, I got the telescoping arm. I've got a wheel right here when I start pulling traction that's got numbers on it. We'll tell you about that in a second. And I got the ankle hitched here that's down on the wheel. Okay. Big difference with this, between this and the other splint and the Hare splint, is with this one, I don't have to have manual traction on this one. I don't have somebody hold manual traction. We're going to go ahead and assess the leg first, from the hip all the way down on both sides bilaterally, PMSCs. We're going to go ahead and put the splint on the injured leg and size it, or the uninjured leg, it doesn't matter. And then we're going to just go ahead and pull traction and get the splint on in place. Okay. So move the Hare Traction Splint out of the way, please. Let's do this leg closer to you. Okay. So can you assess him for me, please, and make sure that he's got a closed, isolated mid-shaft femur fracture? Show me how you're going to assess him for that.
Okay, so
go ahead and palpate him, assess him just like I did the first.
Well, you check for the opener flows, the bone sticking out, and then you push on their hips.
Not up to medial pressure on the hips, right?
And then you can push on the joint.
Okay, what do we got to do for the long bones?
Well, you have to like that.
Onset offset pressure on the long bones. Go ahead and do it.
And then you push down the joint. Right?
Don't push down on it. Just squeeze it. Circumferential pressure. It goes around. Okay. Onset offset pressure on these long bones. Okay. Do that bilaterally on both sides. Onset offset. Circumferential on the knee. Onset offset. Okay. And then when we get down to the feet, it's PMSCs on both feet, right? So he's going to come down here to the feet at the same time. Do pulses on both feet. Motor. Sensory. And then capillary flow, right? Okay, so we have a mid-shaft femur fracture here on this left leg. We're going to put the Sager splint in place. So what I'm going to do first is I'm going to go ahead and put this on the injured leg, and we're going to get the groin strap on first. Okay. So that's going to go up there like a crutch. So if it's a male, you might have to be forward. You say, sir, you want to move yourself over to the right so I don't watch anything, right? This has to go up pretty high, right? When you put this groin strap on, I want it going in this position up towards his hip. I don't want it coming across a fracture site. This groin strap holds the whole splint in place, okay? So if you have to, slide this up underneath his buttocks. Now he's not going to be moving his leg because he's in a lot of pain. You'll see a lot of people, if the patient has a wallet on in their back pocket, they'll stick that behind the wallet and kind of use the wallet as a fulcrum to hold the splint in place. If the groin strap is still slipping, sometimes if you have a long enough groin strap, you can even go through the belt loop of their pants and hold it that way. Okay? But to put the groin strap on, I'm just going to come through both of these rings this way, right? Getting all the slack out of there. And then I'm going to come through just like any other football helmet this way. Make it tight. And we're just gonna pull it as tight as we can that way, okay? There. Try to get it as tight as you can. Get all the slack out of it. And just tighten it down, okay? Now to save some time, I'm not going to make that real tight because I want to move on to the other straps. So I can mess around with that in a second because I think it's getting caught on your wallet or something. Okay, once that's in place, I'm going to go ahead and put the ankle hitch on. Okay. Now this ankle hitch, it just comes straight over the foot. Okay. If this little V right here is too short, and you can get some more slack just by loosening it here at this buckle. Okay? It's come straight over the top of the foot like that. Okay? And when the ankle hitch goes on, it doesn't go around the bar and the ankle, it just goes around the ankle. Okay, it just velcros around the ankle like that. Okay? Let's see if I can get that strap a little bit tighter. Alright. This Sager's not working very well. Anyways, when I start to pull traction, on the device, I'm pulling out this way, right? And I'm watching the numbers on that dial start to come out as I start to pull traction on the device. Okay? I'm pulling traction on this foot. Now, what's different with the Hare Splint is when we pulled the Hare Splint, we pulled traction until we had pain relief, or until we had one foot that was equal to the other foot, correct? Since we have numbers on this wheel, it's a little bit different with the Sager for how much traction we're pulling. We're pulling up to 10% of the patient's body weight, or a maximum of 15 pounds. Okay? So if the patient weighed 130 pounds, how many pounds of pressure am I pulling on the 13 pounds. I'm just moving the decimal point 1 point to the left. 130.0, move it 1 point to the left. That's how many pounds of pressure we're pulling, 10%. So if he weighs 130 pounds, I'm pulling this out till I see 13. If he weighs 14 pounds, I'm pulling this out till I see 14, right? What if he weighs 170 pounds? What am I pulling it to? 15. I'm only pulling it to 15 because it's a maximum of 150 pounds. 15 pounds of pressure, 150 pound patient, right? Okay. Once I have traction pulled and the groin strap is holding the splint in place, then I'll get my support straps. And they're up here. Okay. I have the longest one, and these are a lot wider, and they're elastic also. And they're Velcro. That goes right over the fracture site, okay? It's nice and tight, and it's okay for this one to go right over the fracture site. Okay, with the Hare, we went above and below the fracture site. So if we have small, skinny straps like the Hare, we're going above and below the fracture site. If we have fat straps like this, we can actually go over the fracture site itself. Okay?
Even if the bone's sticking out?
Even if the bone's sticking out, yes. We can go over the fracture site. What I'd probably do is maybe put a moist piece of dressing down there first so it wouldn't stick to the pad itself, but we can go over the fracture site. This big elastic strap that's wide helps to put more stability to that area there. It help to hold that bone in still. Okay, that's what's good about these wide straps. The second strap, we're just going to go right over the knee. Okay, and then the third strap, we're going to go over the ankle and over the locking mechanism here. Because if someone comes by and kicks that and we lose traction, then that's not good, correct? So with the third one, go over the ankle and right over the locking mechanism. Now some Hares might come in their bag with a fourth strap. That's the longest one. If we have a fourth strap, you can go ahead and put this leg straight and put the legs together. Put the fourth strap around both ankles and then elevate both legs if you have to. Okay? But most of them have three. So we got one over the fracture site, one over the knee, one over the locking mechanism. The strap's in place now. What's the last thing I'm going to do? Pulse motor sensory cap refill again.
All right.
Okay?
You did it.
Okay.
2:30.